Hello everybody, and welcome to Species Specifics. Today we're going to be discussing lizards. If you are new to this series, the goal of these lectures is to cover unique diseases of different veterinary species that are specifically mentioned in the ICVA NAVLE study guide. I've also included some diseases not specifically mentioned, but may still come up. The focus of these lectures is on disease recognition through images, clinical signs, and diagnostic tests. I have also highlighted key, easily recognizable characteristics in bold. There are only a few notable diseases to remember about lizards through the NAVLE, so I put them in no particular order. We will start with infectious stomatitis, which is also known as mouth rot. This condition is usually caused by Aeromonas or Pseudomonas infections. Clinical signs include petechiae in the oral cavity that may progress to caseous material. Treatment involves debridement, cleaning the area, and antimicrobials. Scale rot refers to ulcerative to necrotic dermatitis. The early stages are sometimes called blister disease. Clinical signs include ulceration, blistering, or reddening of the skin. Treatment involves antimicrobials and debridement of the area. Maintaining appropriate environmental hygiene is important for prevention of this condition. Salmonellosis is considered to be part of the normal microflora of reptiles and is potentially zoonotic to humans. It is not recommended to try and treat reptiles to eliminate the salmonella in their microflora. Therefore, prevention of zoonotic disease involves assuming that all reptiles carry this pathogen and washing your hands thoroughly after handling. Yellow fungus disease is caused by Nanisopsis fungi species. Usually these infections develop due to stress or poor sanitation. Once it develops, it is contagious between reptiles. Clinical signs include crusting dermatitis that may invade into the deeper tissues. Treatment involves antifungal medications. Adenovirus infection is primarily described in young bearded dragons, and it affects their liver and GI tract. It spreads through fecal-oral transmission. Clinical signs include weight loss, diarrhea, lethargy, neurologic signs, and sudden death. Treatment involves supportive care. Lizard mites are in the genus Hirstiella. Infestation by these mites can cause anemia or secondary infections. Clinical signs include coarse skin and spending a lot of time soaking in water in an attempt to drown the mites. Treatments include permethrin or ivermectin. Cryptosporidiosis in lizards is caused by Cryptosporidium saurophyllum. It invades the gastrointestinal tract, causing thickening and loss of motility. Clinical signs include diarrhea and weight loss, and treatment involves supportive care. Gout results from accumulation of urates in the organs due to excessive dietary protein, dehydration, or renal disease. Clinical signs include weight loss, refusal to move, and swelling of the joints. Treatment typically involves correcting the underlying problem. Dystocia can occur due to a stuck egg or follicular stasis, which is where egg follicles have failed to ovulate and form a large mass. Clinical signs include a distended abdomen and straining. It typically requires surgery to treat in most cases. Vent prolapse can result in prolapse of the cloaca, colon, oviduct, hemipenes, or bladder. It usually results secondary to another condition. In this condition, you will observe a large mass extending from the vent. Treatment involves replacing the prolapse or amputating the mass in some cases. Dysectesis is incomplete or inadequate skin shedding. There are many potential causes, including low humidity, ectoparasitism, etc. Clinical signs include retained spectacles appearing as a cloudy eye, as well as bands on the tail or toes. Treatment involves moistening the skin and gentle removal. Bladder stones in lizards typically result due to unbalanced diets or excess dietary oxalates. They are most common in green iguanas. Clinical signs include a palpable mass within the abdomen, lethargy, and anorexia. Treatment requires surgical removal. Gastric neuroendocrine carcinomas are seen in young bearded dragons and can rapidly metastasize to other tissues. Clinical signs include weight loss, vomiting, anemia, and bloody feces. This condition has a poor prognosis and typically results in euthanasia. Finally, we have metabolic bone disease. Metabolic bone disease is caused by secondary nutritional hyperparathyroidism. This results from low dietary calcium to phosphorus ratios or a lack of UVB light exposure. Clinical signs include a swollen or distorted jaw or long bones, and bone fractures. Treatment involves correcting the diet and the underlying hypocalcemia. Thank you for watching Species Specifics. If you enjoyed this video, remember to like, subscribe, and share with your classmates. Thanks again for watching, and we will see you in the next video.